Hi, it's Dr. Centeno, and today I'd like to show you a compilation of MRIs that are really 12 to 13 years in the making. We started doing stem cell work really before anyone else in the world for most of the procedures you're going to see. And as a result, we've collected lots of MRIs through the years. Now, these are before and after stem cell type treatments and or platelet type treatments. Most of them are stem cell related. And for some of these categories, we have a lot more images, but I've really put together a smattering of different conditions here. So please be careful, because what you're going to see now is focused on Regenexx procedures. These are procedures that were performed by highly trained physicians who aren't allowed on our network unless they're highly trained. They've got to demonstrate their knowledge of what's called interventional and not surgical orthopedics, meaning they have to know how to place stem cells and other things precisely into certain areas using fluoroscopy or ultrasound. And that's very, very different than what's out there. So what the results you're seeing here are tied to the Regenexx procedures. So one word of caution: some conditions don't generally have significant MRI changes, like severe knee arthritis. There we might see a bone marrow lesion go away, but not regeneration of large stretches of cartilage. That doesn't happen in 2017, and if someone's telling you that it does, run the other direction, because they don't have a clue what they're talking about. And in those conditions, many of those patients will get very nice relief, and that's probably due to changes in the cellular and chemical composition of the joint long term than anything else. So please be very careful and don't be fooled. The results you see here were obtained using a specialized lab that can produce much higher stem cell and platelet concentrations than you can get with little bedside machines that many physicians use. And in addition to that, these procedures are done via X-ray guidance and ultrasound and are very, very difficult to perform. There are very few physicians around the country that can pull this off and get these results. So don't be fooled by a chiropractic office injecting amniotic or cord, quote, stem cells, because they're injecting dead tissue and not performing the complex procedures you see here. Also, a quickie bone marrow stem cell procedure that takes marrow out with a little doohickey and puts it right back in doesn't have the same stem cell numbers that cause these results to happen. It has a much lower yield and far fewer stem cells. It's easier for the doctor, but it's not best for the patient based on what we know right now. And an orthopedic surgeon or another physician who's performing a blind injection and sticking bone marrow in a bedside machine isn't the same as what you see here. Again, they're not going to get these kinds of results. So one of the big things that everyone likes to see with stem cell procedures or is looking for is some changes in cartilage. And this works if you've got the right kind of stem cell procedure, and if you've got the right kind of small cartilage defect. It's not going to work so well if you've got the wrong type of osteoarthritis, which is severe bone on bone, or you've got the wrong type of stem cell procedure, i.e. a fictional stem cell procedure like amniotic. So this is actually a hole in the cartilage from one of our early days of cell therapy use here. You can see a hole in the cartilage right there where that red is, and then I'm slicing across it, and I'm slicing across it, and you can see that same area fill in very nicely in the after images. So quite a big difference there in that hole in the cartilage. Again, this is the bone, the dark stuff, and the light stuff here is the cartilage. So that's what we're seeing there as a hole in the cartilage, and then it fills in after a stem cell procedure. This is another type of MRI. Again, we've got the bone way up here, and then this lighter gray stuff here is the cartilage. And you can see a break in the cartilage there, a break in the cartilage here, a break in the cartilage there, and then in the after images, most of that fills in. This is actually looking at cartilage thickness, where we see an increase in cartilage. So these are 3 slices across the knee. This stuff, the dark stuff again is the bone, the lighter stuff is the cartilage. It goes from 0.2 before the procedure to 0.3, so from 2 millimeters to 3 millimeters. Again, another 1 millimeter increase here, and then a 1 millimeter increase there. So that's about a 25% increase in cartilage thickness after the stem cell procedure. And this is actually a series of images in an ankle where we've got what's called an osteochondral defect here, where we've got a bright spot in the cartilage and a bright spot in the bone, and then progresses all the way to this where there's no more bright spot in the bone and no more bright spot in the cartilage. So another big area that's important is whether or not we see any kind of change in the low back disc. And again, with the right type of stem cell procedure and the right type of disc, you can see changes. What we're not going to see ever at this juncture is the ability to take a bone-on-bone disc or a completely collapsed disc and turn that into a new disc. Again, if someone tells you in 2017 that they can do that, you need to run. So this is actually a patient that we saw who had a small disc bulge kind of out to the side that you can see here in his 2014 MRI. We treated that in 2015 with some of the cultured stem cells where we placed that directly into that area. And you can see that these are the 2 slices after that show that he's got a smaller disc bulge. The biggest issue is that he's now got more room in these 2 blow-ups between the disc and the nerve. So the disc is here and the nerve is there than he did before. And that's really what we're looking for, right? To put room between the disc and the nerve, because it's the disc that irritates the nerve. This is a large disc herniation, and this was no stem cells. This was just our 4th generation platelet lysate that was injected around the nerve's epidural. You can see a humongous disc bulge herniation there. Then obviously you don't see that. So what I believe happened here is that the platelet lysate helped to clean this stuff up. This is actually what's called a high intensity zone tear, HIZ. Best seen probably on this one here. It's the bright spot in that circle, and it's a tear in the disc. And you can see here in the after image, you don't see that tear in the disc. And this was injecting same-day stem cells directly into that area. So now let's talk about ACL tears. Now we have so many of these ACL tear MRIs. If you go online, you'll probably find 30 of them. I've just chosen a few here to look at. So again, these are patients who, instead of having ACL surgery, they had a precise injection of their own stem cells into the ACL. Here we see a very obvious tear in the ACL, and I've outlined the ACL with those triangles, and then that tear in the after image goes away. We also see here on a same ACL, but a different type of imaging sequence, a blown out appearing ACL, and then a much tighter ACL. This is a 40-year-old white female who returned to full function without pain, and the 6-month follow-up is shown. So you can see here that this ACL in between these yellow triangles is totally blown out. It should be nice and dark. In fact, it should look like this one, a nice dark band going diagonally. And this is the before image here, and this is the after image there. And again, no surgery, just a precise injection of her own stem cells directly into that ACL. A very difficult procedure to pull off. It's not just inject it in there and hope it goes to the right spot. That doesn't work. You've got to get it directly in that spot. And frankly, right now, there's only about 100 US physicians who have the capability of doing that. And the vast majority of those are in our network. This is a middle-aged white male with, again, a complete tear. You can see the ACL here is kind of wispy and blown out. You can see here the ACL is nice and thick and dark. This is 6 months after, again, a precise injection into that ACL. This is a woman from Singapore who flew over to Colorado to get this treated. She's young, so this is only a 3-month follow-up. And here you can see the ACL looks wispy and light colored, which means that it's torn and doing poorly. Here you can see a nice, dark, robust ACL. Same thing here. Same patient, just a different type of image sequence. This is the before, where it was read out as complete ACL tear. And this nice dark ACL is the after, where it was read out by the reading radiologist as normal ACL. So let's look at shoulder rotator cuff tear. This is another area where we see some pretty big changes in MRIs. So this is a patient here who's got a fairly large tear in the supraspinatus tendon. Supraspinatus tendon comes all the way across this way, then you can see it stops, and there's a gap there. And you can see in the after image that gap goes away. We're not seeing that gap anymore. So this person had their own stem cells injected under ultrasound guidance directly into that tear. Now this is a really big tear, kind of at the maximum limit of what we can do with just stem cell injections. And again, these are precise stem cell injections, very different than the kind of thing you see out there being done by chiropractors or the odd orthopedic surgeon who doesn't know how to use ultrasound. So we have a large gap right here. Again, this supraspinatus tendon should come all the way across. It doesn't. It stops in the middle there, and then it continues down that way. Now we see here an ACL, or sorry, a supraspinatus tendon that comes all the way across. This is a smaller tear in the supraspinatus tendon. That's right here, and you can see a little notch out of that tendon. And then you can see here in the post images after the stem cell injection that you no longer see that notch. It's filled in. So that's a partial rotator cuff tear. So now let's look at some bone work. Bone work is very reliable with stem cells. We can see some pretty amazing things when we treat bone with your own stem cells. So this is what's called an avascular necrosis lesion in the knee. And it's the normal bone kind of looks like this light color. But you can see this dark piece of bone here in the knee, and that indicates basically a dead area of the bone, or what's called osteonecrosis. Now you can see that same area goes away and brightens up in the post images. So quite a big difference there when we look at this area here. We don't see that nasty dark area. We see normal light colored bone. And so this was an injection of the patient's own stem cells, very precisely performed under X-ray guidance, where we took a thicker needle called a mini trocar, and we put it right into that spot and injected stem cells right into that spot after we mapped the location from the MRI to the fluoroscopy. Now this is a total mess. This is a patient over here pre-treatment, this MRI of her shoulder, and she was basically told there was no surgical solution for this. This was too big a mess. This was a fracture that didn't heal, and then on top of that, she developed avascular necrosis where the bone started to die. And she was told she needed a shoulder replacement, that there was nothing else that could be done. Now, we precisely injected stem cells, and you see here the 5-month, and then you see here the 2 years. So as the bright stuff decreases, that means healing. And she's had a 95% improvement in her symptoms and is not a surgical candidate at this point, all because of a precise stem cell injection procedure, not just throw some magic stem cells somewhere near the shoulder, but a very precise injection procedure that was performed under X-ray guidance directly into those areas of that shoulder bone that were having problems. Now this is a avascular necrosis of the hip, and the before image here, the dark stuff in that hip is bad, and the light stuff in that hip is bad. And then we can see the after image the hip bone itself gets brighter, and that's good because that means more normal. And then in this water-based image, same hip, it gets darker, which means, again, that's normal. This guy's had complete resolution of his symptoms. He would have had likely a hip replacement at some point without treatment, but he obviously didn't need a hip replacement after this precise injection of stem cells into that area. Now, this is a college athlete with what's called spondylolysis. On this side, he's got a congenital issue, meaning he was born with part of his spine not connected. On this side, he actually has a fracture, and the fracture line is right here. So that part actually fractured, and it tried to heal, but it couldn't heal. He had actually had a stem cell injection kind of in this area at another clinic, but they really didn't have the expertise to pull it off, so he came to our clinic, and we were able to, again, precisely inject stem cells plus demineralized bone matrix right into this area, and he had nice evidence of healing of this without surgery. Now, this is a guy who was looking at a low back fusion. And again, this is not something you can do blindly injecting stem cells into someone's back. This was under x-ray guidance, and it was a very difficult procedure to do to protect his nerves and nerve supply while we were doing this procedure. So that's it for my little compilation of MRIs. I hope you've enjoyed this. Again, we have many more of these pictures, but I've tried to give you a smattering of different areas. Realize that some things we can see heal very nicely on MRI. Other things, as I've discussed, like severe knee arthritis, you don't really see those big MRI changes. But some of those patients, if they're carefully chosen and treated the right way, do very, very well. So thanks so much for watching, and have a great day.